the doctor.
Back pain affects 80% of Americans at some point in their lives, and the causes range from a sprained muscle to broken bones in the spine. Now, those fractures in the spine can bring an end to living a full and active lifestyle. Dr. Jeffrey Fernio of Boca Raton Regional Hospital is here to tell us more about vertebral fractures. And first of all, doctor, thank you so much for joining us this morning.
Thank you, man.
Here's my question first of all. What are the different types of vertebral fractures?
Well, most commonly what we see, especially down here in South Florida with elderly population and osteoporosis, which goes along with the age, is with weaker bones, most commonly you see a compression fracture, when the bone is just too weak to handle the forces of daily living or even a minor fall or bend or twist.
It's tough to find anybody, you know, especially from their 20s on, and hasn't experienced some back pain. How can people tell the difference between normal aches and pains and a vertebral fracture?
Well, if you're young and you have a minimal injury, it's very unlikely to have a fracture. But if you're over 60, particularly female, or have a known history of osteoporosis or family history of osteoporosis, and you have even a minor twist and the pain does not get better with a few days of rest and heat and so forth, anti-inflammatory medications, then it's a good chance you have a fracture, and you probably should see your doctor at that point.
Perhaps you don't see a doctor for a while. Could you get, you know, the two of them mixed up, you know, just regular back pain and a fractured vertebrae? Is it easy to get those two mixed up, or what's the one thing that maybe sets it apart that you could really tell?
Well, it actually is quite easy to confuse them. We find some people that have even been to an emergency room or seen their doctor, they have an x-ray done and they don't see a fracture, so they assume it's just back pain. But if the pain persists more than about a week, and it's pretty constant with activities, mostly getting up and down from a chair, bending, twisting, it's probably a fracture, and you probably need an MRI to actually make the diagnosis.
Okay, let's talk about treatment options for a vertebral fracture. Let's talk about those, please.
Most commonly, fractures can be treated by just rest and altered activities, just avoiding bending, twisting, any aggravated activities. But if the fracture persists more than a couple weeks and you're really not able to get back to your normal activities, then we commonly recommend a vertebroplasty, which is an injection of cement into the bone fracture, and that pretty much immediately stabilizes the pain, stops further collapse, and enables a person to regain their active lifestyle.
I was going to just ask that. Is it possible to regain that active lifestyle even after that?
It normally is. Yes, most people get back to all their regular activities in a few days. Some people even get back to work the same day. We've had some real remarkable successes with that minimally invasive treatment.
Okay, outstanding. Doctor, thank you for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.